Could you fill me in a little bit about exactly, I guess, the levels of preparedness and understanding of what was coming? And, a lot of states, a lot of people in that general area in the Midwest, when we've spoken to them, had said they were learning a lot from New York and California in terms of resourcing, personnel, overall preparation. There's a lot of collaboration, which is fantastic, but now we're at the boiling point where it needs to have been for fruition, right? So do you feel like the state at least was prepared for this?
I think we definitely saw what was happening in New York City and the state overall and tried to learn from that as kind of a red light, an indicator, if you will, of what might happen here. That being said, I think that helped with PPE and potentially staffing and efforts to ramp up testing capacity, which was helpful. But at the same time, there's only so much you can do if you kind of open the floodgates to exposures through community-based reopening efforts that were too premature and too fast. So that's my concern, is a lot of those public health prevention efforts are extremely important, and the state and the public health agencies have been amazing in Arizona in terms of ramping up contact tracing. I think they have about 300 contact tracers right now that they're working with, which was really great. But at the same time, if you're going to do that, you can't just kind of open up the floodgates to everything so people can go out and expose themselves. And especially if you're not encouraging community-based mask wearing, which they just changed last week. So now that is a mandate. But realistically, it felt very kind of contraindicated, if you will, where we're going to put a lot into contact tracing, making sure we have testing capabilities, which are all critical pieces, but at the same time, then overwhelm those systems and the hospital systems by doing little to discourage people in the community to be safe. Because I think the concern most in public health have is when you do reopen, that almost gives the impression that things are fine, that there's no COVID in the community. And unfortunately, I think that communication was lacking. There really wasn't still a push of saying, we are still seeing COVID cases. At the time, we were still seeing over 500 cases a day. So you still need to be safe. Here's how we need to approach this. You still should wear a mask in public and avoid non-essential things unless you really, really need to do them. Or here's how to practice public health safety out in the community. So I think that was kind of the issue, where you saw this really weird nuance where we were investing a lot in some public health efforts and some healthcare efforts, and then on the other hand, just not doing that with the public dynamic of COVID-19 control and prevention.
Sort of attempting to appease both sides and ending up negating any value of either option, and
Really.
yeah, and you speak to like this mindset, and I think it almost came across like borderline celebratory, like here in New Jersey, like obviously we've entered a phase where we feel a little bit better because we're not facing the burden that we did in March and April. But of course, there's still an issue where it's declined, but it's still at a concerning rate. And you're absolutely right. We can't look at this as if mission accomplished. No, it's just like trying to remain the proper forms of vigilance. So I guess asking for solutions, or I guess, do we walk back some of the leniency that we took? Do we just bolster more preventive measures? What should we do now in this very unfortunate space?
I think it's all of the above, honestly. Part of this is the community education and communication aspect. Because like I said, there was that misconception that as we were reopening, things were fine. New Jersey, cases went down, we're great. Arizona actually never saw that decline. We were just kind of stagnant. So that's a huge piece to it, because there's so much politicization of science right now. Mask wearing, we need to do so much more in terms of communicating to the public that this is still a problem. COVID-19 is still being transmitted, and here's how you can be safe. Here's how to wear a mask safely. Here's access to masks. That's a huge piece to it. We really need to look at hospital response, but also capacity. Because my concern is if we don't start slightly scaling down on elective surgeries, with an 85% census right now in hospitals, that doesn't leave a lot of wiggle room. And I know that there's increasing stress on the healthcare system. So all of these things really need to come into play. We need to keep doing contact tracing and really evaluating where are we starting to see little clusters popping up. I've seen a lot more cases in urgent care facilities, which is what worries me, because in some regard, those patients aren't sick enough to be hospitalized, which is good, but then bad because we're very reliant on them to stay home and isolate themselves appropriately. So how are we making sure those people have the tools and the education to be safe and stay home? So all of those little nuances really come into play, and they require a very holistic approach and not just one uniform thing saying we just need to focus on contact tracing or just give everybody a mask. You need to support the community and encourage them and give them the resources to be successful in this, because we are very reliant on people right now. There's that kind of false dichotomy about the economy or public health, and we don't have to necessarily close down everything again, but we might need to start looking at an incremental process until we can get this under control.